So you may be thinking like, okay, Dr. Gumm, all this sounds great, but I just want kind of a process of what's this look like from an implementation standpoint in my practice. Well, I've kind of broke it down into phases for you to look at. Phase one is chiropractic. We got to focus on our foundation. Are we maximizing the lifetime value of our current chiropractic patient? Can we add metabolic to our new chiropractic patients and existing chiropractic list? Can we upsell them into pain niches? That's the first two strategies that went over into the BPA revenue pyramid. That's phase one. Phase two, we start marketing, but at the top of that pyramid, we start marketing a pain niche. Maybe it's decompression, maybe it's neuropathy, or maybe it's knee pain. And then we start downselling those into chiropractic and metabolic. We're doing reactivation campaigns with those new leads. And then we look at the phase three, metabolic niches. We started looking at, once we've mastered phase one and two, you can literally quadruple your practice with phase one and two, just with one niche and doing phase one really well. Two niches, you can do even better. Three niches, you're doing even better. One of our practices in Des Moines, I think he's doing around $5 million a year. He's our best practitioner, but he's doing three niches in phase one perfectly. But if we phase three, we would say, okay, I want more metabolic patients in. We teach you how to use body contouring to get those metabolic patients in. Those metabolic patients coming in for body contouring, majority of them need weight loss or gut health or keto or fibromyalgia or gut or autoimmune or thyroid protocols. Again, it's all narrowed down to that one-page wellness survey that they fill out. It tells you exactly what protocol they need. And then you can upsell those patients into chiropractic and pain niches. So again, we just go back to the fundamentals of the BPA revenue pyramid when we get into these phases. Then phase three is really just not even a phase. It's ancillary niches that we can add on along the way. Shoulder pain, plantar fasciitis, ED, regenerative medicine, if you want to get into the medical model, which I really don't feel like you need, but we'd have the training for it if you do. But that's really the phases and how we kind of lay it out from really in our onboarding process with our company. We literally say, let's get phase one down before we go to phase two. It's actually a requirement. So that's the phases of implementation that we look at. So the way we kind of keep everything together and make sure that your operating systems are getting the most out of your efforts is we call it the fundamental five. So we have our clinical operating systems, which all of our protocols, our automations, our processes that process those niches. We want to make sure your phones are working for your marketing. Day one, day two are working. We have all the training for those. Upsells and downsells, BPA revenue triangle, memberships, continuity. And then we get those down. Then we look at the business operating systems to make sure that we're running your business effectively and efficiently. Are we doing a daily stand-up meeting before the shift? Are we doing it effectively? Are we doing a weekly level-up meeting every week to report KPIs and obstacles? Are we getting through those obstacles efficiently? Is our mission, vision, and core values and principles in place in our practice? Those are the five fundamentals for our business operating systems within our 72 business CEO tools. We pick five that are most important. And then we look at your marketing and say, okay, are we following the fundamentals of marketing? Are we doing the foundational principles of marketing? Are we hitting activate, optimize, expand, and scale? Those are the levels that we kind of named ourselves. A lot of people want to skip steps in marketing and they're missing opportunities. So these three operating systems, we're coaching you on consistently and making sure you're maximizing your efforts in the fundamental five to get the most out of your practice. So let's wrap this up. So the BPA revenue pyramid, we did a quick case study. We took a chiropractic practice that was getting 30 new patients a month with chiropractic, closing about 20 of those at $1,800, $432,000 per year annually in income. We started taking them through the BPA revenue pyramid, adding metabolic activation campaigns, upselling into pain niches, upselling chiropractic into metabolic. And we took it from $432,000 to $1,092,480. We took that new revenue, it was about $55,000 per month. We took 10% of that and put it into neuropathy marketing. And that produced about 50 leads per month. And they started closing around 45 to 50%, which is $840,000 in new revenue from niche marketing. And then we took that, we're at the top of that pyramid. And now we started teaching them how to downsell into metabolic and chiropractic. This practice could have done a lot better with this, but I didn't want to use a perfect example. Another $129,384 in revenue. We look at the new annual revenue is $2,061,864 from 432,000. We take the hard cost out from nutrition kits to infrared devices, stimulation devices, $294,348. You're not buying those until the patient buys it, so it doesn't come out of your pocket until they buy a care plan. So the net profit of this practice was $1.7 million just by following the BPA revenue pyramid. And they're a basic chiropractic model. They're reaching double the people. They're maximizing their revenue 3 to 4 to 5 times more revenue because they're getting more premium niches coming in their practice, and they still get chiropractic. So if you want a copy of this 25-page report, you can scan here, take a picture of it, scan it later. But it's a great report. We put it together on pretty much everything I just talked about the strategies, and you can go reread it through it. It's a great report that we created. Scan it and enjoy it. If you miss it, I'm going to go on, but if you miss it, just reach out to our team and we'll get you the report. You can jump on a call and we can talk about it and so forth. So what did you need that number for? So the 469-772-4173 number, if you text virtual 25 to that number, we have a virtual event and we're going to in January, and the value of that is thousands of dollars. We'll give you 3 logins for your team. We're going to help you identify your constraints in your office, your obstacles. We're going to help you devise a plan for 2025. We're going to help you go through the BPA revenue pyramid and maximize the efforts with that. So you can actually have a great 2025. And you don't have to join Blueprint to Practice Automation to be able to do that. We're going to give it to you for free, but there's only one caveat. You have to finish our strategy call with our team to hear more about our practice, about our organization and program.